Good morning, ladies and gentlemen. I'm going to present a case of chronic renal failure. It was a terminal case. The patient was about to die, and he was in the hospital due to respiratory arrest and severe acidosis, respiratory arrest. He was on an oxygen mask. Why he came to homeopathy was his granddaughter was my junior. He's a homeopathic doctor. So, and the physicians, the allopathy says that they can't able to say anything about this case. Maybe the patient will be going to die within a time. So they were about to go for a dialysis, but the outcome, they are not clear about the outcome. That's why they taken the patient to our clinic. So I will show you. Before that, I just point out some of the important things about the renal failures. Okay, the 10% of population worldwide is affected by chronic kidney disease, and millions die each year because they do not have access to affordable treatment. According to the 2010 Global Burden of Disease study, chronic kidney disease was ranked 27th. The list of causes of total number of deaths worldwide in 1990, but rose to 18th in 2010. Over 2 million people worldwide currently receive treatment with dialysis or a kidney transplant to stay alive. Yet this number may only represent 10% of people who actually need treatment to live. And in England, according to a recent report published by NHS, kidney care, chronic kidney disease costs more than breast, lung, colon, and skin cancer combined. So the homeopathic perspective, what we can do with the homeopathy, that's the question. Because if the patient is coming in an earlier stage, you all know about the creatinine level. If the creatinine is less than 5 mg, I think you are following the mg, milligram per, yes. So the creatinine is the important point in a renal failure. If it is elevated more than 5, maybe more than 6 or 7, it seems to be, the kidney seems to be 90% closed. 90% working is closed. So the scope of cure or scope of recovery is very low. The patient should go for a dialysis, and patient has to be live with the dialysis. And it seems to be very, very, it's very economically very problem to the normal people. I think all over the world, it's a problem. So what homeopathy can do, if the patient is coming before the creatinine level is 5, we could able to cure that. I insist we can cure that. And if the patient is coming after 8 or 9, it's not curable, but we can continue the treatment until the patient die. And if the patient is coming after 2 or 3 episodes of dialysis, it's very difficult to treat. We can give medicines to the quality maintenance of the life. So here the case. The patient was 68-year-old, admitted in critical care unit. He was on renal failure, respiratory arrest with end-stage renal disease. He was on an oxygen mask. The condition was critical, advised for dialysis. This was a laboratory finding. Please find the creatinine is 5.7 and the urea is 122, the normal being 28. And the random blood sugar was 258. This is the original report. You can find it's 5.7, the normal is 0.6 to 1.5, and BUN is 122, it's 7 to 22. This was the normal one. It's the date, please note the date. It was on 17/5/2015. And this is the blood sugar value. It's 258. He was referred for dialysis and was under oxygen mask, cannot able to talk. bedridden, respiratory discomfort, urinary output was very low. Yeah, please see the video. Please see the respiration. It's due to severe acidosis. Look at the abdomen. He was not able to lie on his back. He's lying on his left side. Please note that. Homeopathically, it's very important. I'm coming to that. And the history of the disease. Normally, the chronic kidney diseases are due to diabetic hypertension. Normally, the population is affected by diabetes and hypertension. He was diabetic since 1995 and was taking insulin. In case of diabetic nephropathy, you know the diabetic nephropathy, because it affected the kidneys. And history of CAD, coronary artery disease, and he was on plagerine and aspirin. Usually high creatinine and urea. He used to have a creatinine level of 3.5 or something like that. He was advising for dialysis since a long time, because the doctor, the conventional treatment is like that. If the patient is going beyond 4, the creatinine is going beyond 4, the conventional treatment says for a dialysis. And why to hospital? Because of the respiratory discomfort and edema, total weakness, increased values of urea and creatinine. He went to hospital. And this was the allopathic perspective. Directly admitted in critical care unit on oxygen mask, advised for dialysis, informed the relatives about seriousness, cautioned as a critical condition. And his dialysis was supposed to be the next day. Critical, the relatives realized their prognosis by allopathic treatment is very bad, so that's why the patient was taken to us. And homeopathic, it's normal, huh? Because we treat the patient, give importance to the totality, give importance to pathology and critical condition. And this was the totality. This was very easy to get because his granddaughter was a homeopath. That's why I got all these things very easily. Otherwise, the patient was dying. He was not able to say anything. At that time, it was very difficult. But according to her, all these totalities is collected. He was a very business-minded personality, very workaholic, obstinate, abusive, reproaching, cunning. He was left-sided, thirsty, anchored easily, doesn't like others to be involved in his area, even close relatives. And the respiration arrested. This is the only thing I taken from the direct patient view. And the rubric selected. Mind abusive, insulting, mind obstinate, mind cunning, sleep position lying on left side, and urine albuminous, respiration arrested, and general side left. Because the urine albuminous means the urine was 3 plus, albumin was 3 plus during that time. And this is the repetization. Can you find the medicines before repetization? Can you tell me the medicine? Please try. Not in depth. All are homeopaths, right?
No.
Yeah?
Lactases? Well, I would start with lactases right away.
Yeah. You save the patient. So the medicine is like, obviously lactases. It's a very simple case. Because it's a very terminal case, but it's a very simple case. Because according to me, I used to take classes all over Europe and in India also. I used to say homeopathy is simple. Homeopathy is very simple if you just go give importance to the patient. If you listen to the patient, listen to the relatives, homeopathy is simple. And make it simple. That's what Hanuman taught us. Okay, so it was lactases. Even VS, Vidolka's expert system, told that it's lactases. After lactasis 30C, on 19/5, that's after 2 days. It was on 17th we give the medicine. The creatinine come to 5.4. It was 5.7. And the urea was 100, I think it was 128. It came to 114. This is the original report. Look at the date. It's 19/5, 112 and 5.4. And on 22nd, it came to 2.2. It was 5.7, and the urea 69. This is the original one, 69 and 2.2. Look at the video after 2 days. What's the difference you feel from the earlier? Yep. He starts complaining. He starts complaining. That's the difference. Before that, he was not able to tell anything. Now he starts complaining. That is cold. Yeah? Yeah, 1 dose. Because after 1 dose, I didn't get any time. Because within 2 days, all these things are happening. So why should I repeat? He's getting angry also. Then next day, he is sitting. He's able to sit. No, why? Because within 3 days these things are happening. Why should we repeat? The creatinine is coming down, the patient is going good, so why should we repeat? Hahnemann itself said that, don't repeat. If the medicine is working, why should we repeat? That's the next day. After homeopathic medicine, patient can walk like this also. This. No. No, the person who took the video, it's just all that. Don't think like that. Yeah, he's walking with the help of somebody. Look, on 26/5/2015, we started on 17th. The creatinine came to 1.8, almost normal. Urea 29, and glucose fasting is 89. Without any allopathic medicines. I stopped every medicines during this period because our medicine has to be worked that time. So I stopped everything and only our medicine has been taken. No insulin, nothing. 258 was of blood sugar, RBS, and it came down to 89. These are the originals. 29 almost came to the normal. It was 22. The normal is 22. It was 190 before. Came to 29 within 7 days, and the creatinine is 1.8. Look, he's walking alone. This is granddaughter, great granddaughter. Yeah, walking outside. Look at the face and everything changed, huh? Look. So this is the beauty of homeopathy. This is what homeopathy offers to the sick person. And within 10 days, patient became normal with no dialysis, no intensive care, no oxygen mask, less expensive, harmless and simple. That's a rapid, gentle and permanent restoration of the health and removal and annihilation of the disease in its whole extent. Thank you.